Hi, my name is Gabriela Resto. I'm a P3 PharmD MPH candidate at the University of Connecticut, and I'm here today to present to you on the pharmacist's role in medical abortion, boosting access, and patient safety. So to start out, what is medical abortion? I'm sure most, if not all of you, have heard something about abortion in the news or in the media recently, but we don't really talk much about pharmacy implications in this area of healthcare. So, medical abortion is considered medication facilitated pregnancy termination up to 10 weeks gestation. And in the past decade, and more recently in the past few years, we've seen a dramatic increase in the utilization of abortion services. And specifically in 2018, there was an almost 40% increase in early medical abortions. Currently, the FDA has approved a two-medication dosing regimen for medical abortion consisting of mifepristone or mifeprex on day 1 and the use of misoprostol or cytotec 24 to 48 hours later. The main adverse effects associated with these medications are cramping, heavy bleeding, nausea, vomiting, diarrhea, dizziness, and fever. And while all of these side effects are associated with both mifepristone and misoprostol, there are actually more adverse effects that have been reported and associated with misoprostol, contrary to popular belief. So this seems pretty easy, right? Patients will go in, see their providers, get prescribed these medications, take it, and their pregnancy is terminated. So what is it about medical abortion that's so complex? And the answer is that there's a lot of barriers, mostly systemic barriers in place, that prevent people from being able to access these services. And the main ones that I want to touch upon, because they're so relevant right now, are the restrictive laws and the limited availability of services. And specifically, two examples that are very prominent are with regards to Texas and Mississippi. And in Texas, they place an abortion ban past 6 weeks gestation, and they place a similar ban in Mississippi past 11 or past 15 weeks gestation. And these two decisions were important because they really influenced the Supreme Court's decision to reassess Roe v. Wade. When we're talking about specific restrictions, mifepristone, the first medication in this series, is REMS restricted by the FDA. And what that means is that a person can only be dispensed mifepristone in qualified clinics or hospitals by certified healthcare providers or prescribers, such as PAs, APRNs, midwives, and physicians, who must be able to 1, diagnose ectopic pregnancy, and 2, be able to provide emergency surgical interventions if needed. All of this started in 2011 when the FDA placed these restrictions on mifepristone because at the time, there was a lack of clinical data demonstrating its safety. And so this was a medication that the FDA really wanted to monitor and assess over time to see if adverse effects or the impact on patients changed. Since then, however, we've seen a substantial amount of clinical data being released that actually supports the removal of the REMS restriction. The first one being that mortality rate associated with mifepristone is so low, it's almost 0%. And what a lot of people don't realize is that there's actually a significantly greater risk associated with continuing a pregnancy and having a physical live birth as opposed to undergoing an abortion. So when we talk about removing the REMS restrictions on mifepristone and cutting back on some of these restrictive laws or regulations, the main thing that comes to mind is the teleabortion study, which was significant because it was the first to demonstrate the safety and efficacy of telehealth abortion and direct-to-patient medication mailing. So before this, patients had to go in, get assessed by providers, be dispensed the medication in office, and then be monitored over a period of time after taking mifepristone. With this study, it demonstrated that mifepristone is actually a completely safe and efficacious drug to be taken in one's home. And this was incredibly beneficial for patients that live in medically underserved areas. And we see this with the majority of patients that were involved in this study who actually lived more than 50 miles away from their nearest study provider. And this is significant because it's actually incredibly reflective of actual US society, right? And when we look at the pie charts to the bottom left-hand corner, the first one in pink shows us that 89% of US counties do not have any type of abortion providing clinic. And when we look at the one to the right in blue, we see that 38% of women living in the US actually live in these counties that don't have any type of abortion services. So this disparity is most impactful for, again, those patients who maybe live in the Midwest or live in rural areas or in states that have less than 5 abortion clinics in the entire state. And this is really important for a lot of those people that have to travel out of state just to seek out these services because it's not practical and it's not feasible. This study was the main study that influenced the FDA decision to exercise enforcement discretion regarding in-person mifepristone dispensing during the COVID-19 emergency. And what that means is that during this time of COVID, especially at the beginning back in 2020, when a lot of medical offices were closed and patients weren't able to schedule appointments and go in and actually get dispensed this medication, the FDA approved for providers to be able to carry out telemedicine appointments instead with their patients, screen them virtually, and then be able to mail them their medications. So patients would just take the medications in the safety and comfort of their own homes instead of having to go in person in the office. And this study proved that this method was actually highly successful. 95% of participants had successful abortions, and these rates were comparable to in person abortion services. We actually see that adverse effects associated with telemedicine abortion were very similar to the rates and the severity of adverse effects with regards to in person abortion services. Also, telehealth services demonstrated that it decreases the need for second trimester abortions, which require more invasive procedures and are actually considered riskier. So, when we're talking about Connecticut specifically, Connecticut allows medical abortion via telehealth as approved by the FDA during this time and has no type of prerequisite ultrasound or counseling requirement in order to qualify for abortion. So when we're looking at the map up top, we see Connecticut highlighted in dark blue, and all the states that are in dark blue have no telemedicine bans. All the states in light blue are states that have physical presence requirements for providers in order to qualify for medical abortion. So again, these are the states where patients have to go in person and be screened in order to qualify for mifepristone. All the states that are in pink have explicit telemedicine bans for medical abortion. So at this point, after everything that we've discussed, why is this important? Right? And the reason that this is an important topic and the reason that we should all care about medical abortion is that it's more than just a reproductive health issue and it's more than just a women's health issue. It's a public health issue. And we see that because a lot of the states that have some of the strictest abortion laws in the country also have some of the worst maternal and child health outcomes. And some of these outcomes include childhood poverty, low birth weight, premature birth, and low healthcare access for low income mothers. And so at this point, if you're still thinking, I'm a pharmacist or I'm a student pharmacist, I can't counsel on or dispense mifepristone because of the current REMS restrictions, why do I care? And the reason that we should care about this is because telehealth services are likely to become more prominent in healthcare. As of December, the FDA actually decided to continue the enforcement discretion and make it permanent after the COVID-19 pandemic is declared over, meaning that as of now, providers can actually continue to carry out telehealth appointments with their patients and can continue to mail these medications directly to the patient's home, even after COVID. And so, furthermore, as a result of this teleabortion study, in 2020, the ACLU and the American College of Obstetrics and Gynecology, or ACOG, filed a lawsuit against the FDA challenging the REMS restrictions on mifepristone. And in May of this past year, the FDA actually began a REMS review of mifepristone, meaning that in the near future, we may see this medication being dispensed in the community setting if these restrictions are lifted. And this is why we all need to familiarize ourselves with the drug and be able to assess and provide some of these counseling points and know these clinical pearls. There are actually some studies that have been done in the community setting in regards to pharmacists, and they've showed that a large majority of patients are highly satisfied with being able to pick up their medical abortion medications in the community setting at their local pharmacy. And these studies included mifepristone. Also, a majority of pharmacists reported to be satisfied with being able to dispense mifepristone, and the large majority of them are also willing and able to undergo additional training to be able to counsel on medical abortion medications. So, as a pharmacist or as a student pharmacist, what can you do now? Right? And the first thing that you can do is connect with your state board of pharmacy. Connect with your local pharmacy organization. And in Connecticut, one of those is the Connecticut Pharmacists Association or the CPA. Connect with your local legislators. Go up to them and speak to them at Pharmacy Day at the Capitol. Make sure that you're advocating for and promoting medical abortion access within the political agenda. You can also engage in interprofessional collaboration, which we all know is the future of healthcare, and align with your local ACOG chapter and support the removal of REMS restriction and really collaborate with them and support them on some of their efforts as well. This can also look like dispelling some of these misconceptions, mostly about misoprostol, right? Because that's what we can dispense in the community setting, and dispel the misconceptions about its safety and adverse effects. Using everything that we've discussed today, um, talk with your fellow providers, talk with your patients, talk with other pharmacists, and really disseminate this knowledge. One of the most important things that we can do right now is provide adequate counseling on misoprostol, which, like I said, is able to be dispensed in the community setting. We can familiarize ourselves with mifepristone clinical pearls, and in regards to counseling, we can learn to provide some of these supportive care recommendations. So, for example, if you do have someone coming up to you at the pharmacy that's picking up a misoprostol prescription, you can go ahead and ask them, are you aware of some of the side effects of this medication? One of the main side effects is heavy bleeding and severe cramping. Do you have enough pads at home? If not, I would really recommend that you pick some up today. And if you don't have enough Tylenol at home as well, I would suggest that you purchase them here. And if you don't know where they are, I'm more than happy to help you locate them. Reminding the patient that you're there to help them and answer any of their questions. For a lot of patients, abortion can be a very difficult and traumatic experience, and it doesn't have to be, right? As pharmacists and as student pharmacists, providing this personalized counseling really shows that we're here to support our patients and that we really want to do the right thing for them and help them ease this process and make it as smooth and as safe as possible. And while a lot of these factors and recommendations are really simple, it does make a huge difference in the lives of our patients and further demonstrates that pharmacists can really have a major impact on patient outcomes as trusted healthcare providers. Thank you so much for tuning into my presentation. I hope you all enjoyed, and if you have any further questions, feel free to reach out to me. Thank you so much.